When it comes to back pain, we need to back up and find out why we're hurting so then we can start healing. Dr. Michael Steinmetz is here to provide background information on our back problems. Dr. Steinmetz is the chairman of the Department of Neurosciences at Metro Health and medical director of the Metro Health Spine Center. So we welcome you here to the show.
Thank you for having me.
We got a spine here. How
Yes,
does the structure of the spine stand up to the aging process?
Well, with our upright posture, this combined with some genetic factors result in the spine bearing a fairly considerable load, more so in the low back and the neck because there's more motion in these areas. And this can result in a fairly significant degenerative process of the spine. And with our aging population, this is becoming more so prevalent now. And the degenerative process in the spine can result in conditions that can cause problems in patients' back. And again, especially now with an aging population, it's becoming more prevalent.
What are some of those problems that people will experience?
So two of the more common problems we see, especially again in this aging population, are lumbar stenosis, and that's really a narrowing of the space available for the nerves in the back. And that can also result in scoliosis, or a curvature of the back. And that's not the scoliosis that we saw in adolescence, but this is more due to that degenerative process. As the discs that we see in the spine collapse and the bones wear out to some extent, the spine can rotate and curve. That can result in symptoms such as back pain, and it can also result in compression of the nerves in the back, which can result in leg pain, numbness, and tingling when people stand and walk, the so-called lumbar stenosis.
Okay, so that's more than just an aching back from doing too much. So
Correct.
Once we've determined why we're hurting, how can we fix it?
Well, most people have back pain. I think you've probably had back pain, I've had back pain, and it's usually a fairly self-limited phenomenon. But if it becomes more pronounced and starts interfering with life, then it often requires a medical intervention. And we often encourage patients to at least initially see their primary care provider to try to determine, is this a real problem, or is this maybe just a strain I had from spending some time on the golf course? Okay,
so if it's very mild, we could take minimally invasive techniques to help?
Well, correct. If it's just mild, oftentimes no intervention is needed, just some time is needed. But if the symptoms become more persistent, say the back pain is lasting more than a few days with just some rest, or there's some symptoms in the legs such as pain, numbness, or tingling, then really a medical intervention is needed at that time.
Okay, so you're now up to scale. What's the next step in there?
Correct. So if your primary care doctor feels that an evaluation is necessary, probably the most appropriate step is a referral to a comprehensive spine center. Really, that's the task we've taken on at Metro Health, is to provide a multidisciplinary team approach to spine, which can provide an accurate diagnosis and then a treatment plan for your symptoms.
And if it just doesn't go away, is surgery then the last option?
Well, we always try to do the least invasive procedures first. Oftentimes just medicine or some physical therapy and rehabilitation is what's needed to cure the pain, and that works in the majority of patients. At times some stronger medications may be required, but if that's just not working and symptoms start interfering with life, then we begin the interventional treatments. And we work with our pain management colleagues and our physical medicine rehab colleagues where maybe injections can come into play. But if none of that is working and symptoms persist and interfere with life, then surgery may be an appropriate step here.
Okay, well hopefully we don't have to get that far, but this has been very good information. To get back on track, check out Metro Health Spine Center. You can also attend a health talk on back pain relief this coming week on Wednesday, April 18th at 6 p.m. at the Holiday Inn.
Next, he lived in Hollywood but called Cleveland home. Looking for places to go, things to do? Welcome to our community calendar. The retirement landscape is changing for both private and public sector employees. Find out about the future of pension plans and how you can be prepared at a free seminar Tuesday, April 24th, 2012 at 1 p.m. and again Thursday, April 26th, 2012 at 6:30 p.m. Both take place at the offices of the Lineweaver Financial Group in Valley View. To reserve your seat, call 1-888-313-4009.